Types of joints such as amphorothosis, which are particularly moving joints, and diarthrosis, which are fully movable. Did you know that the adult human body has 206 bones? The human hand, including the wrist, contains 54 bones, and that the femur or thigh bone is the longest and strongest bone of the human skeleton.
Classifications. Functional classification of joints are based on the amount of movement allowed at the joint. Synarthrosis is an immovable joint. An example would be a fibrous joint. Amphiarthrosis, slightly movable joints, mostly in the axial skeleton. Diarthrosis, freely movable joints.
Structural classification of synovial joints. They have 6 special features: articular cartilage that covers the opposing bone surfaces, band-like ligaments, a joint cavity, synovial fluid lubricant, a fibrous joint capsule, sensory nerve fibers, and blood vessels. Structural classifications of fibrous joints. They connect bones with dense fibrous connective tissue.
Synovial joints and where they are located. Pivot joint. It's between a C1 and a C2 vertebrae. Hinge joint, elbow bone. Saddle joint, in the wrist. Plane joint, between the tarsal bones, ankle. Condyloid joint, between the carpal bones and the wrist. Ball and socket joint, hip bone.
Synovial joints and what each one does. The pivot joint allows for rotational movement. Hinge joint, one bone moves while the other is stationary. Saddle joint allows angular movement similar to condyloid joints, but saddle joints allow for more movement. Plane joints allows for gliding motions, but it is limited and does not involve rotation. Condyloid joints allow angular movement and can move side to side, also similar to the saddle joint. And ball and socket joint allows the greatest range of motion, as all movement types are possible in all directions.